Okay, it's a pleasure to welcome everybody on this really ugly morning, to be honest. The rain has not daunted the spirits of people who are coming. And in fact, when I was talking with Sarah Berger, who's here a little earlier, she said, well, it's kind of a relief to have something to get out and do, on this kind of a day. But we're very pleased to welcome everyone to this event, really. The Martilla Group Strategies, and John Martilla presenting, sort of findings from a polling around issues that are near and dear to everybody's heart and probably profession that's here. And this is an event that is sponsored jointly by the George Washington University School of Nursing and Amplify. And I really appreciate, having worked with, the folks from Amplify, Audrey Shepherd, and everyone else. So, and I want to thank Rana Halbavox, who has been the point person for the School of Nursing on this event. And without saying more, I'm going to turn it over to John.
Thank you very much. My pleasure.
And just one more thing. We're using microphones so that we can record this. And I also wanted to say a specific, I always do this, to Pat Forde Regner, who has been instrumental in making this connection between GW and Amplify and the Martilla strategies.
Thanks very much.
There you go.
Let me tell you what we'll be reviewing. During the past 20 years or thereabouts, my company's been conducting research on healthcare, but during the past 2.5 years, our company has conducted 5 or 6 national surveys, largely about American reaction to healthcare, healthcare reform, the Affordable Care Act, et cetera. And I think that, so what I'm going to be presenting to you is kind of a comprehensive look at American attitudes towards healthcare, and ACA is a focus of it. At the end of this, I make some recommendations about how to save this bill, which is really hurting right now I think for a lot of reasons. But let me just take you through this, and we will go. I welcome the opportunity because this gives us a chance to talk about this stuff carefully and slowly, but it's about a 20-minute presentation. Key findings about healthcare that must inform strategy. A majority of Americans do not understand the substance of details of the Affordable Care Act or healthcare policy generally. It has been ever thus. This was not part of the grounding strategy that informed strategy at the beginning of the administration. I think they assumed, hopefully, that the American people would grapple with this more. There are reasons why people don't know this, but there was a survey, I think, in the past week or so from Kaiser Healthcare documenting how little Americans really know about the Affordable Care Act and healthcare reform generally and so forth. This is complicated stuff, number one. Number two, as you'll see, 88% of American voters have health care insurance, and they're very happy with it, which means this is, you don't pull people to the barricades with those kinds of backgrounds. Given this lack of substantive understanding, a communications platform based upon core values is essential. It's not as if Americans don't care about health care, they do, but they think about it through the prism of their own beliefs and values about health care. Point number three, Americans are surprisingly happy with their current health care, their health insurance coverage, and even their prescription coverage, even their health care costs. This defies what most people assume to be the case, but we have done polling and polling and polling, and over again, Americans are happy with their health insurance coverage. 90% are happy with their prescription coverage, which defies all kind of conventional wisdom. So that's the lay of the land. But they're very worried about the future, and I can show you some of those findings. They're deeply apprehensive of what's coming their way. In fact, 25% of the American people believe that they will lose their insurance in the next 3 or 4 years. So there's a huge cohort. In Massachusetts, which has 98% coverage, 40% of the people worry that they'll lose their coverage. 25% believe they will lose their coverage in a state where the coverage is guaranteed, which is an insight into two things. One, future apprehension, and secondly, what people really know about the substance. Key findings. Americans have many concerns about our country's larger healthcare system and the need for change. However, the Republican attacks, I'm a Democrat, by the way, so, but this is not a partisan presentation, have inflicted real damage on the ACA. I think many of the charges have not been answered. Others have been answered ineffectively. Doctors and nursing, this is a really important finding. are increasingly unhappy about the changes sweeping through our healthcare system. We did a survey in December of 10 of 500 doctors and 800 patients, all who specialize in hospital care. Docs are really, really grumpy right now. But this unhappiness preceded ACA, and the danger is that you can conjoin this and make them look like they're opposed to ACA as opposed to just being concerned about the changes sweeping through. For those of you who are nurses or lead nurses, you know how pressurized their lives are in terms of the bureaucracy, overwork, things like this. There's a lot of this stuff. It'd be easy to conflate these concerns and turn them against and make it look like they're against ACA. A sharp partisan ideological divide has existed from the early moments. We did a survey in February of 2009, 1 month after the president was elected, and Republicans and Democrats were split widely. I'll show you one of those slides. And then finally, women were the base for ACA. I've got a slide that documents that, but that is no longer the case. This is a horrifically bad finding. Men are not going to be are not the key to this kingdom. Women are. Critical questions. This applies to all public policy questions. First of all, what do Americans really know about an issue? That's an increasingly important, there's a revolution in American news production and consumption. It has fractured the old rules, and I will talk about that in a little bit. What can they learn? This is more art than science. What can Americans really learn? Most public policy issues are litigated outside of public understanding, full public understanding, and especially something as complicated as this. So this has to inform strategy. If people can't learn it, that doesn't mean you can't curse the darkness. You have to deal with that environment. What are their beliefs and values about the issue? When we deal with all of this stuff, we pay attention to core beliefs, core values, whatever the public policy issue. What do people really believe? What do they care about? And what is the issue's salience? If 88% of the American voters have insurance, and if they are tremendously happy with their current insurance, that diminishes salience, does not take people to the barricades. So you have to understand what the issue's salience is. Along with the loss of support among all women's support for ACA has declined during the past 2 years. In 2009 and 2010, women were consistently much more supportive of ACA. Overall support, the Wall Street Journal, which does wonderful polling, Peter Hart and Bill McInturf are great pollsters. They asked the idea, was this a good idea or bad idea? It was 39-39. We did a national survey in August of this year. We used the same wording, and it was 30-46, good idea, bad idea. That's serious deterioration and not good. The second was the same survey in January. Should we repeal it? 45-45. When I looked at those numbers, I said 45-45 after, kind of a failed communications effort. That's okay. We can deal with that. In August, it was 46-40. Repeal is different and harder and more difficult than is it a good idea or bad idea. And there is speculation that because of the health insurance industry support of ACA, that they're saying, Republicans, go do your thing, but we're not repealing this bill. But who knows? I think that this is now going to be debated. This is, in 2009, this is representative on every single cohort. Postgraduates, four-year grads, women, some college, non-college. Women were decidedly more supportive of ACA. Married women, not married women. Every single cohort, women were significantly more supportive of ACA than men. But now what's happening is, in the August survey of this year, good idea, bad idea, 30-43 men, women 30-41. This is a horrific finding. And ACA needs women at the barricades. What do people know about, what do they know? How do they feel about their care? Americans, again, are satisfied. Let me see if I can get this to you quickly. First principle, Americans have a limited understanding. I'm repeating myself a little bit, but I want to drive these points home. And some of the details will never be understood. Americans have always, why is this now? Here we go. Americans have always struggled with financial and policy details of health care. It's very complicated. There's a profound change in news coverage, sometimes with calamitous results. There's a wonderful article in the most recent issue of New York Magazine by David Frum, who is the former Republican speechwriter, talking about the power of the right-wing news media and the blogosphere and so forth to control information. And what his basic thesis is, which I agree with, is that there are two sets of facts now out there as opposed to the old days when there was one set of facts and the Republicans and Democrats could argue about them. It's a very persuasive and important article. Finally, again, 86% among voters and high levels of satisfaction. 88% of voters are satisfied with their health care. This does not bring people to the barricades. How satisfied? This is 2011, 87 to 10. How satisfied are you with your health insurance coverage? Do you have coverage? 87%. Satisfied, 88. Prescription coverage, 86 to 13. These are high levels of satisfaction. They are enduring. They are consistent nationally, locally, wherever. And people love their docs, and they love their nurses, and they love their pharmacists, not as much as they love their docs and nurses. But this right here, these are people they trust. So if the docs and nurse go south on ACA, that could be a very serious and unfortunate development. Sweeping changes in the insurance system. This is what was the basis for why people would support ACA. These are national figures. This means the entire population. 17% have been without health insurance for more than 6 months during the past 3 years. 28% have changed health care in the past 3 years. 28%, 30% of the American people, there's tremendous churn sweeping through the system. 16% said it was involuntary. 11% said the change of insurance was stressful. 48% worry they will lose their insurance in the next 5 years. 30%, this is nationally, worry that they will lose their insurance in the next 5 years. Think it's likely they'll lose their insurance in the next 5 years. 57% are very concerned about costs, and 72% say their premiums have gone up a lot during the past 3 years. This is what was out there, and this is now kind of, this had to be done in a certain time period. By August, because with the following reason. The devil I know, 88% are happy with their insurance. They like the prescriptions. Is better than the devil I don't know, even though people have these tremendous apprehensions about the future. American healthcare values. This is where you can, these are rock solid values. Americans do not believe any family should be driven into bankruptcy by the cost of medical illness. These are universal values, Republican, Democrat, conservative, liberal, whatever. Americans don't believe anybody should deny insurance coverage because of a pre-existing medical condition. This drives people crazy in focus groups. Americans want all kids to have good health care coverage. The CHIP expansion, speaking as a partisan, every Republican voted against the CHIP expansion in 2009, with the exception of 5 or 6, I think. Americans hold their doctors and nurses in very high regard, and they want these health care professionals to make the medical decisions. These are 4 deeply held values which can be brought into this discussion more effectively. There is extraordinary churn, 30%, which means that making stable, enduring insurance protection is important to Americans of all persuasions. Americans do not want, this is what Democrats have always screwed up, Americans don't want the government involved in dispensing health care. And when you create that kind of monster in people's minds, they're horrified by it. But they want the guarantees. They want health care guarantees on a range of issues. Prescription for seniors, Patients' Bill of Rights, et cetera, Medicare, Medicaid. Americans believe everybody should have, this is like a dangerous concept among Democratic politicians, but this is a deeply held value. In all the focus groups I've done during the past 3 or 4 years, even among Republicans, people believe that everybody should be covered. It's a moral consensus, and you don't have to talk about it taking place tomorrow. People are now really concerned about the costs. But this is something you should not be afraid of. Americans want everybody to be covered. Other beliefs. Americans give very high ratings to their health care. Many Americans believe Medicare is at risk. If you talk to younger Americans, they believe Medicare is a complete myth. It's not going to be there for them. That is documented in focus groups, and it's documented by national research. People believe Medicare is not going to be for Mary Robbins, who works with me, under 30 years old, believes it's not going to be there. This is a belief. And this is very, very important. Americans do not know much about Medicaid. They have no idea, really. There's no understanding about Medicaid providing the financial basis for nursing homes, et cetera. And when you ask Americans in focus groups who comprises the Medicaid population, they have no idea that it's seniors in nursing homes and kids with disabilities. The issue of health care costs is back on the front burner. Believe it or not, it was not such a burning issue 6 or 7 years ago. Now it's on fire. Other beliefs and judgments. Americans worry that employers will cut back on health care. And when you have focus groups, they say, that's a good idea. Employers should pay it. But then gradually, because of their concerns about the economy, they back away from that. As we know, ACA provides coverage for employers with more than 50 people. There's a widespread belief that patients have to be their own advocates, but this is not a happy thought. If you're talking to seniors or people who are more vulnerable and so forth, they don't want to be their own advocates. This is not something they welcome. They want to be protected by people like you. Americans believe seniors should have prescription drug coverage, but this is a very mildly held belief. In 2002, Democrats bet the ranch on prescription coverage for seniors and lost. It was a devastating loss. Americans were interested in national security. Americans want this to happen, but they're not. Does not bring people to the barricades again. Americans believe the current healthcare system is driven by the desire for profits, even among not-for-profit hospitals. Americans have no understanding about for-profit institutions and not-for-profit institutions, zero. We just did a survey in Massachusetts, and we asked people, what's your guess? 70% believe all the hospitals in Massachusetts are for-profit, when in fact only 15 hospitals in Massachusetts are for-profit. They are sharply critical of the pharmaceutical industry, but when you ask Americans who take one prescription drug every day how important is it, 65% rate it a 10. So on the one hand, they're angry, furious at the pharmaceutical industry, their perception about it, but they love their medications. Americans are antagonistic toward the insurance companies, but they hold HMOs in slightly different, more favorable. Partisan divide. This was 2009, 1 month after the president was elected, and the wise guy headline there from that survey, 1 month after President Obama assumed office, the new era of bipartisan cooperation was over. Republicans, the country was in the wrong direction, 80%, conservatives, 72%, independents, self-described independents, I should say, wrong direction. So within 1 month, the point I'm making here is that the Republicans were never with the president before he assumed office, which had profound implications for the strategy of passing things like health care. The role of government, just a warning here, yellow lights blinking about the role of government. This is from Kaiser or Harvard, the Harvard School of Public Health. To help slow the growth of health insurance premiums, the federal government should establish a new independent scientific body which will decide whether certain procedures should be approved and so forth. 5336. Kaiser and Harvard are serious organizations. This poll data was seen to be a valid representation of American opinion. All we did, we repeated this question, but then we presented an alternative. You know, really, the federal government should not be doing that. And they flipped. 40 to 53 people were against it. So if people, you have to understand that there is real tension on these issues. Here is some examples on values. Requiring health insurance companies to cover pre-existing conditions of deeply held consensus values, 63-30, 2-to-1. This values asset, was never sufficiently deployed during the discussion about ACA. It is a hugely meaningful issue for most Americans. And furthermore, do you know anybody who has denied insurance coverage because of pre-existing conditions? 37% of the American people say yes. I don't, personally believe that 37% of people know somebody who is denied, but they believe they do. This gives an indication of how serious it is. And how worried are you that someone in your family might be denied? 55% are worried that their family may be denied coverage because of a pre-existing condition. Deeply worrisome concern for the American people. Preventing medical bankruptcies. Among all voters, a cap should be set on family medical costs to prevent bankruptcy. 57-31 is a total. Democrats, 68-23. Even Republicans on the far right side, 48-41, embrace the idea of preventing medical bankruptcies. Rock solid consensus value. Problems that emerged in our early research. Individual mandates. I'll tell you a story. I was part of the marketing strategy team in Massachusetts to bring in the Massachusetts healthcare law. And every healthcare maven was in the viewing room watching me moderate. And I said, watch this, guys. We're going to put this in the center field bleachers. A group of progressives, well-educated, concerned about healthcare. And I said, now we get to the mandate. And the group just said, well, you know, really, we're not for the mandate. And we kept on talking. And finally, what I had to say was, okay, 35-year-old guy makes $75,000 a year, drives a Porsche into a tree, and is paralyzed for the rest of his life. Do you believe you should pay? And I said, well, maybe not. The mandate has been a dangerous issue inside this. And now, you know, the most recent surveys show nearly 3-to-1 of Americans oppose the mandate. I understand I'm for the mandate. I understand the substantive implications if we lose the mandate. It'll, you know, unravel ACA in so many important ways. But this is an issue that has to be dealt with yellow lights blinking all the way through. Americans, this is really rough stuff. Americans believe ACA will benefit others, not them. From what you know, Will your family be better off or worse off? Better off 17%, worse off 40%. Who do you think will benefit? People like you or other people not like you? 17-40. As a result of the new health care bill, the overall health care cost in the country will increase or decrease 64-15. As a result, will your health care costs increase 61-10? These are really serious, threatening findings for the ACA. By decisive margins, Americans believe their health insurance coverage is better than most other Americans, by margins of 61-8, they believe. So this is the kind of stuff that's on the inside of all this. When presented, progressives across the country engaged in sort of delusion during 2009 and 2010, looking at the poll results and saying, well, if you really add it up, you know, people are really on our side of the issue. In fact, we asked the question to clarify this. Congress should leave the law as it is, 16%. Congress should make additional changes to increase the government's role, a la single payer, 26%, 42%. Congress should repeal most, 29. Congress should repeal the law entirely, 23. 52%. So that's the proper gauge of public opinion. By the way, I believe ACA can be saved. So I'm not being as gloomy as these poll results are. This is a major finding. We worked with a company called IMS Health, which is a data mining company for the past 2 years. We did 2 huge national surveys. And what we found, sort of accidentally, was there is a huge constituency for privacy of medical records out there. These are people who kind of share the beliefs of the Tea Party system, but these are huge numbers. Look at this right here. Computerizing the medical records of all Americans is one of the most effective ways to reduce our costs, improve quality, support ongoing healthcare research. Will reduce medical paperwork, minimize the potential for error, ensure that your medical records will be available when you need them. 45%. Computerizing the medical records of all Americans is a serious threat to the privacy of individual patients. These medical records are bound to be insecure. I mean, actually, 50%, this question should be. So 50% of American people believe that medical records are a good thing. 45% are very, very worried about it, which is not to say they don't love technology. With Robin, we just did a national survey on the benefits of medical imaging. 86% of the American people believe a medical imaging test is absolutely essential to their health. Strategic observations. I'm closing here. The economy will be the dominant political issue of 2011 and 2012. In addition to healthcare fatigue, Americans just say, please, no more, stop, no more healthcare discussions. Is there the question? This is a strategic conundrum. Is there room in the public square to talk about healthcare? That's a really tough issue. The Republicans will stand the attack using ACA as their metaphor for an overreaching government. A White House megaphone is unlikely. They're worried about the economy. So the question is, who defends ACA? Key question, what is in it for the average voter? Voters do not understand how ACA will benefit them. Right now, they fear ACA will have negative and unintended consequences and undermine their current care, and women are critical. So here are the recommendations. Republicans can't be allowed, even though they have successfully defined ACA, and even given the economic concerns, Republicans cannot be allowed to control the terms of this debate any further. A political firewall made up of understandable benefits and values is required to save it, even at this late hour. Don't forget, the repeal in our research in August was 46-40. So we still can make this thing work. Americans do not understand the details of healthcare policy or ACA. Given this lack of understanding, we need a communications campaign based upon core values and understandable benefits, things that Americans can get as opposed to things they can't get. Given the White House's need to focus on the economy, the healthcare advocacy community would need to assume primary responsibility for this communications campaign. The question is whether this community, which is diverse and has different takes on the importance of these issues, can be unified to present a unified strategy. 4, go back to basics. We've been through this. There are more that might be brought into this, but here is our example. Supporters of ACA have 3 or 4 or 5 key benefits and values that can be deployed. Number 1, preventing. Now, this is old news to people in Washington. It is new news out there in the hinterlands. And this is stuff that really makes a difference to people. Preventing health insurance denial based upon pre-existing conditions, the end of medical bankruptcies, maximum health care for America's kids, a future where more than 90% of Americans have health insurance. Obama gave a wonderful speech last year in which he talked about this as a morally held concern, and I think Americans share that. I'm not the least bit trepidatious about advocating universal coverage as kind of a moral framework for this discussion that we get to in the next 6 or 7 years. And based upon nonpartisan CBO projections, ACA will reduce national health care costs. we are just allowing this conversation. This horse is out of the barn. So far, I'm not sure if it can be brought back. But you cannot, remaining silent on the cost issue is not an option. So they cannot be allowed, in my view, I'm speaking as a Democrat here and a supporter for ACA, they cannot be allowed to say they support these benefits and be against ACA. So I would just flip it and say you're against these benefits and you're against these ideas, as opposed to saying I'm really all for this, but we're just not going to do it with ACA. Don't engage in wishful thinking about the role of government. Guarantees and protection should be emphasized, not the government involvement. The Ryan Medicare proposals, which Republicans have not fully backed away from, is an opportunity to kind of dig in and kind of go back to basics on some of these fundamental issues. Medicare is an example. Americans love their docs and nurses. These medical professionals are trusted. They should be visible in the defense of ACA. It'd be very easy to find doctors out there who are grumpy about this and talk about the dangers of ACA. Finally, renewed support for ACA among women is a strategic imperative. Women have to be a much more visible presence in the ongoing communications campaign. And by the way, when you look at healthcare generally and public policy generally, women are generally much more compassionate, much more interested in the soft sides of healthcare, increased access, better care, and so forth. Men, because they're worried about the football teams and so forth, they are much more concerned about things like cost. So women can be used, I think, very believably arguing about the practical benefits of this. And that is it. We have a summary, a one-pager, of the key strategic recommendations that we make at the very end. And so I'd be glad to answer any questions. I hate to rush through this stuff so quickly, but this gathering today served the useful purpose for us to kind of get our arms around the entire conversation and talk about. There are other things that should be part of this, but that'll give you a general sense of what's out there. So, Dean, without further...
Actually, I'm going to grab the microphone. Would really encourage it's on. There we go. Folks to think about questions, and I'm going to start it out with a question. And my question, John, really is, so women have become less supportive. Are there key issues, or do we know why women have become less supportive?
I think the women they've gone the way of all Americans right now, which is that this thing has become a monster to them, and they just don't believe in it anymore. I think the issues that we talked about right here, this is a values benefits package. It's this, we know that these are values that Americans believe in. They're also part of ACA, and that's where I would take it back. And I think the problem is that the people inside Washington, advocates like yourself and so forth, again assume that this is old news, that people have heard this before and so forth. They really haven't. If you talk to people, I did some focus groups after Scott Brown won his election in Massachusetts, and we did a group among Democrats who voted for Scott Brown. And I said, "Why'd you do this? What's going on here?" And half the group said the Affordable Care Act, and I said, "Tell me about it." They didn't know anything about it. It was just a completely fictional monster in their brain. And when we began to talk about these benefits, saying, it's got pre-existing conditions, bankruptcies, and things like that, and we said that he should have told us that we didn't know that, and so. Believe me, and this was documented, as I said 2 weeks ago, I think, by Kaiser in a national survey. And I think the thesis of the article in the Post was that people don't understand the benefits, but it may be too late because now they're just reacting to too much government, too much stuff, and so forth. So I trust that if American women got this, understood the convergence of these values and these benefits, I think their support would go back. And my hope about saving ACA is based upon the difficulty of repeal, as opposed to being against the idea. I don't think by November of 2012 you will find majority support supporting the Affordable Care Act, but I think repeal is a different political matter and much more difficult, and that's the place towards which we should be heading.
Okay.
So I haven't heard you say much of anything about the prevention aspects of ACA, and I would think that would play to women.
You're absolutely right, and it should be part of that values benefits package.
Okay.
It's a hugely important part of it. It should be, and it should be part of this. We're producing a larger narrative about what we've learned and what we think should be done, and prevention for sure should be part of it. And kids. Americans, care about kids' coverage, and there are provisions in ACA which expand this coverage. And again, what's the political mistake that's been made here is Republicans say, well, I'm for ending denials on pre-existing condition. I'm for ending bankruptcies and so forth. The question is, you can't have it both ways, and this is the dialogue that's failed us.
Hello. I'm just curious as to what the demographics were as far as who you surveyed, and also I don't know if you included any questions tying the relationship between ACA and improving the conditions of the economy, or if any people could make that connection.
I think, dealing with your second one first, I think to say that ACA will benefit the economy would be a sell that would be virtually impossible. I think that's too far gone. I think what you can do is say CBO, a nonpartisan organization, said this will reduce national health care costs. That's better than saying nothing, which apparently that's the current answer, say nothing. Secondly, in terms of the surveys, all of these surveys are representative of national voters. So, and they are, we watch the demographics and so forth. So it's fully representative, which means women are typically 52, 53% of our surveys. 13 or 14% are postgraduates. The most progressive cohort in the United States right now are women with postgraduate degrees. On every single question, they are likely to be the most progressive voters beyond ethnic constituencies like African Americans who are overwhelmingly Democrat. But in terms of progressive values and so forth, that's a key target audience. And we watch postgraduates, men and women, a lot in all of our work because postgraduates are more likely to grapple with complicated public policy stuff, and oftentimes they foreshadow the evolution of American opinion on a bunch of these key issues. But this, look, this is like real stuff. This is not fake stuff here. This is, we know, if you convene a group of Republicans, all hardcore conservative Republicans, and present them with these options, they would have a very hard time not agreeing with 4 out of 5, if not 5 out of 5 of these issues. And prevention is absolutely should be part of it.
How much of this developing resistance do you think is due to people believing that gigantic misconceptions about the Affordable Care Act that are out there? I mean, they believe in those core values, but then out there are all these ideas and
I think, there's a, I had a magazine here. Did I somehow lose it? Where did it? Oh, here it is. This is worth reading. This is from the, I will do this very quickly, from the New York Magazine of November 28th. David Frum, prominent Republican speechwriter, says that, but the thought, he's talking about the conservative media collection. But the thought leaders on talk radio and Fox do more than shape opinions. Backed by their own wing of the book publishing industry and supported by think tanks that increasingly function as public relations agencies, conservatives have built a whole alternative knowledge system with its own facts, its own history, and its own law of economics. So this is like a revolutionary change. 20 years ago, the New York Times, the Post, the Journal, the three major networks, they set the news table. Now we've got a fractured news table, where people, and also what's happening is at 6 o'clock at night, people don't have to watch local news. They can watch, whatever. So I think that this is a very, very important article by a leading Republican thinker, who's been banished from his party, by the way. That's one of the things that happened. He was thrown out of the Republican think tank for doing this. So I think that what's happened is that the beginning of this fight, people should have been informed by what's out there, which is they're never going to get the substance. So therefore, you have to kind of build a communications campaign built upon these values. Instead, what's happened is the Republicans have created this kind of image of a monster, overreaching government inside your, bedroom and so forth. It's just too much government. There was a time limit on this. David Axelrod, who's a smart guy and a friend, believed that they had to get ACA passed by September 1st. Because he just knew that there was a time limit. Because the tension is, the devil I know, 88% of coverage, people love their coverage for the moment, is better than the devil that I don't know. And then by September 1st, and the legislative process was a nightmare. I mean, bringing people into those kinds of conversations, it was a horrible devastating blow to the thing. So right now, Americans just kind of have a vague sense that this is an overreaching government. They don't understand what's there.
And that's hard to combat.
The alternative, again, it's a legitimate strategic conundrum. Is there room in the public square to try to save ACA? The obvious answer is no, there's no room. You got to talk about the economy. But look at the deterioration since January of what's happened in terms of public attitudes. It has gone down not horribly in terms of repeal, not repealable. If we don't do anything, we're likely to lose the entire thing, meaning repeal.
I just wanted to interject for a minute, and I hope we continue this important dialogue. I'm Forde Regner. I know many of you, but I'm a senior advisor to Amplify Public Affairs, and Robin's drawn in. He's here, who is the president and CEO. Amplify formed a partnership with John and Audrey at Martilla, and since that time have been engaged in presenting this information and then working with some groups on strategy in terms of their own issues around the support for various components of ACA. So I just want to put that context. And the reason I wanted to have you all hear this as nurse leaders, as representatives for nursing groups, and as educators and public health professionals, because this data has been presented to people over at HHS and the White House, et cetera. And I wanted you to be part of that dialogue and to understand what was behind a lot of these conversations, because you're shaping the next generation who has to, or the current generation of individuals delivering care, whether in the hospital setting, in the community, in public health. And this is what they're combating. At the same time, there's this incredible support for the health professionals, and an acceptance, I would say, a growing acceptance that's in all of this, of the advanced role of nurses and PAs and others in their healthcare. I think we, as a group, have worried a lot that people wouldn't accept that, and I think they're wide open to it, and that's not the issue, but it's all this stuff behind what we see going on out there. But it has to be dealt with. And, one of the questions, John, I still am even befuddled in the rural community I live in when I'm standing there with several senior citizens who say that, government shouldn't be involved in their lives. They're on Social Security and Medicare, and that's it. That's all they have. And their grandkids, who they have holding on to, is receiving Medicaid. And because it's a poor community, 13, 14% unemployment. And they all say, but they're not them, they're us. It is mind-boggling. And I have to say, these alternative media and fact finders have really gotten into people's heads. So I don't know any other thoughts you have on that, but
the way I think about this is that you saw the kind of devastating findings about the impact of ACA. Will it cost you more? Will it cost the country more? Is it for me? Is it for other people? And things like that. That is really tough stuff. So we have two choices. One is to curse the darkness and say the infidels shouldn't believe that, or we use that data to inform strategy. These are the obstacles we have to overcome. And that's, I think, the way to think about it. These are by the way, this happens in politics all the time. You deal with these kinds of issues. You deal with deeply rooted political problems which are against your case, and you map out a strategy to deal with them forthrightly. And I'm recommending something. I'm not recommending a negative strategy. I'm recommending a very robust, positive strategy where you take this to the people and you say, if the national healthcare advocacy community came together and said, okay, this thing is in trouble right now, we could lose it, it could be repealed, and the way out of this is to present a unified voice emphasizing this, plus prevention, probably one or two others, understandable. They have to be understandable so that people can, one word explains it. Then I think we'd have a fighting chance to kind of move women back in place and prevent repeal.
John, I'm Audrey Shepherd, and I'd make a couple of points. One, in addition, I don't have a mic, I'm sorry. Okay. I'm Audrey Shepherd and work with John and do women's health consulting and so forth. And one of the points I'd make is that in addition to possible repeal, which I think is questionable, a lot is at stake and a lot is riding on this in the 2012 elections. So it can, and John, you may want to comment on that, but it will be used, you know, very much in the marketplace of ideas, in particular Senate races and House races. The other thing I wanted to mention is that when John talks about all the various places that we've been with him presenting these ideas, one of the first was something that Carolyn Jacobson, who's here, who chairs the Women's Health Task Force, Carolyn, identify yourself, of the National Council of Women's Organizations, which is 230 organizations. Some of you may be part of that. So, you know, a lot is afoot in terms of being aware of this, and that conversation was in May of this year, so it was a full 6 months ago. So I would just say that this is something that seeds are being sprinkled and, you know, people are talking about it, but a lot more needs to happen to reach critical mass for women's groups and health professional groups and others to get on board and create something where nothing really exists right now as a full-fledged campaign.
That is a charitable analysis, because I think actually American support for this has deteriorated. So we are now in a situation where this thing is moving away from us, and we better do something to stop this, to break it. I think it's really difficult. And the Republicans will use the Affordable Care Act in 2012 as a weapon inside these campaigns. And we can, again, the alternative is to you just can't avoid this criticism. You just have to take it on a little bit. You just can't let this happen. And I think, honestly, I think the way the politics lay out, I think that without the healthcare advocacy community coming forward to save this bill, I don't think we can make it. The political direct course winds right now are pointing in the wrong direction.
Recently, I read a report by Lake Research Partners. They had done some doctor-nurse triads in polling about physician and nurses' knowledge of ACA, and it was surprisingly low. Physicians, among the physician and nurse community, very few really knew what it was about.
Right.
So given that it sounds like we're losing support among that group, what other strategies can we use within our own professional groups?
Well, I think that Americans love their docs and nurses. They really do. And they trust them. And so I think the visible presence of docs and nurses in this campaign publicly is really very important and would be reassuring. I think it's low-hanging fruit to find a bunch of conservative doctors who will just say this is going to be terrible. There's a lot of you know, grumpiness among, you know, when you sit down with nurses and doctors, which we've done recently, it's, you know, they are really beleaguered. The nurses in particular are really beleaguered. And docs, there's a huge divide among doctors in our experience between younger docs under 45 who are kind of internet savvy, all that stuff, and older docs with their own practices. They hate what's going on. I mean, you know, in terms of medical records and things like that. They think it's a complete sham, as an example. Many of them do. And so it's tough. But I think having them in the mix is very, very important. And I think that the national organizations should make their voices heard.
This has been fascinating information. Thank you so much for sharing it with us. Since everybody's concern is jobs, 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 and certainly for the people of my generation, I see a lot of my friends' children without jobs, and so to capture their attention is really hard. So how can we weave this very important message into that scenario, which will have to be done for the 2012 election?
Well, again, I think it is a really serious strategic conundrum. Is there room in the public square to defend ACA? There's not really room, but the alternative is unacceptable. So we have to get in. I think the way to think about this practically and politically is that it's the advocacy community that has to carry the load. The advocacy community writ large. In Massachusetts, there's a powerful, powerful medical community. And there's great faith in the Massachusetts healthcare institutions and so forth. And, you know, these leaders are a visible presence in most of the healthcare debates in the state, and we're indispensably important to making sure that the Mass law passed. Let me give another example. This is really, what do Americans know? Massachusetts has 97 to 98% insurance coverage, fact. And when we did a survey of Massachusetts voters, we came back and 97% said they were insured. So the reality met the reality. Then we said, how many people are uninsured in the state? This is Massachusetts. With this high level of insurance and a high level of education, the average estimate was about 25% are not insured. One of the great achievements of modern healthcare policy is unknown in one of the most well-educated states. That tells you everything you need to know about what Americans do and do not know or will not know. So we're circulating a memo to the governor and his allies saying, look, this is, you know, important information, because what's going to happen is that next year, July, August, September, October, national media is going to be coming into Massachusetts to take a look at this so-called model for national health care reform. And by the way, Massachusetts voters, is it working for you? 2 to 1 say yes, it's working for them. And so they, you know, it is working, it is effective, it has insured people, but they don't know about it. It's just amazing. And by the way, Governor Patrick, who's a friend, he's on TV all the time, and he talks about this. 97% of us are now insured and things like this. Ongoing, he doesn't miss a chance to talk about that and educate the people and so forth. But that just shows you how tough it is to break through. I think it's an enormously difficult challenge, political challenge, and I think the only way to do this is it's got to be the advocacy community.
The previous speaker was talking about linking jobs and the ACA, and I think that's a missed opportunity that we really need to capitalize on. There are so many unemployed in this country, and people who are unemployed, healthcare comes with employment in this country, and that has been both a blessing and a curse. And for someone to frame the debate and the concerns on how many of you have lost a job in the past year, and do you still have health care, and what would happen if you lost your job, those are all very important concerns that I think could make people identify with this issue a little bit better. If you could say, under ACA, you would have the opportunity to purchase insurance even if you didn't have a job. And that is something that Americans have absolutely no idea about.
I agree.
And the other piece is that alternative universe that we have out there in the media. And we need to be talking, instead of to like-minded people, we need to find a way to talk to those people in that alternate universe, because people do not listen. If they're very arch conservative, they don't listen to liberal media. They feel that network news is giving them incorrect data. They think that what they get from Fox is gospel truth. And so when you deal with 2 different groups of people getting their information in different ways, you have to find a way to crack into that group, so that you know, talking to liberal women is not necessarily the best answer. We need to find a way to talk to people that are on the cusp of that group that are kind of leaning towards the conservatives, that can be swayed by that fear. And fear-mongering is an extreme tactic that's going on, and Obamacare is their favorite mantra, and we need to figure out a way to deal with that.
That's a daunting challenge. I would say the first step is to go back to basics, bring our base back together, and the people outside, just beyond our base. In terms of influencing Fox News, I don't know how that can be done. I mean, I think it's it's just a different challenge. But I believe there are enough Americans out there who are not captive by Fox or whatever that is, you know, we can get. And repealing is different. Repealing is different. That's where the rubber meets the road, the repeal. And I think we can win that fight. In terms of the economy, I think what you talked about is totally legit. In terms of trying to stitch ACA together as being beneficial for the economy, I don't know how you do that.
I'd like to say thank you for your work. It's crucial, it's important. And I'd just like to share with you a story that highlights the relevancy and also just the everyday practicality of this information. Recently, I traveled to Portland, Oregon, and I hopped in a cab to get to a restaurant one night. And in the cab, the usual conversation ensued. Oh, you're new to the city. Where are you from? Are you here on business or pleasure? What do you do? And so the cab driver found out that I'm a nurse. And so he turned around and he looked at me. He was still driving, but he looked at me in the face and he said, "Oh, I have a question." And I thought he was going to ask about a medical condition, about himself or his family, but he said, "Do you really think that the ACA is going to be repealed?" And I couldn't believe what I was hearing. And I thought, where am I? And so really, people are thinking about this, and they're looking to, as you said, nurses, doctors, they're looking for their trusted healthcare professionals for answers.
Right.
And it was just amazing.
I just had an idea. Just get out there and say, MitCare works.
Thank you, John. It's always exciting to hear what you have to say because it triggers a lot of follow-up ideas and suggestions, many of which all of you in the room have already shared and offered. But I would say that against the backdrop of all of the challenges, along comes opportunity as well. And I think particularly for the nursing, the advanced nursing, the social work communities, this is a moment to really take on and hold and make your own in many different ways. And I think it does start with the basics of what are the facts that people think and believe. How do you educate them as the trusted source, and how do you start to dialogue and have those conversations? Obviously, a lot of that work is already underway, and your organizations and professional societies and universities have started that. But there is still a lot of work to do, and I would invite all of you through the Amplify has its Disruptive Women in Healthcare blog, and we do a lot of initiatives, and we are going to be doing a whole series on health reform in the coming year, early in the coming year, and if anybody is interested in following up and giving us suggestions and seeing how we might incorporate the polling data and research that you all might be working on, we'd love to continue to talk with you, because I think this really is a moment of opportunity, both individually in the work that you're doing and through your organizations and societies, et cetera. There's just a tremendous moment here that, while it's frustrating and frightening, I think if we rally and think this through strategically, despite the fact that it's daunting, I think it's worth taking this time. And for that taxi driver and so on, is really having the opportunity to do education on the spot. And words matter, and people do twist the messages and so forth, and it's up to us to push back with other messages. So a challenge to all of us here in the room today.
Mary Jean?
Thanks. I guess the other question I have is, did you poll any of how they value quality of care? Because I think that's sometimes, I think as nurses and as healthcare providers, we talk an awful lot about improving the quality and the safety of the care. But I've also seen data to suggest that people aren't willing to pay for that, or are, while they value it, they don't value that with their money.
If you ask Americans how satisfied they are with the health care that they and their family receive, very, very high ratings in the 80s and things like that. If you ask Americans who have been hospitalized during the past 2 years, how is the quality of your hospital care? 90%. Americans are just delighted with the way to think about American is today they're happy, they're deeply apprehensive about the future. And the stories that people talk about the, hospitals care not really working and so forth. I know it's true, because I know it's substantively it's true, but it's not true in terms of American public opinion writ large. They just are not there. We just finished a survey in Massachusetts, and we interviewed people, and 90% of the state was happy with the hospital care. They're happy with the health care that they and their family receive and so forth. So this is a huge mountain to climb when you're talking about bringing ACA into those kinds of attitudes. And give the president credit for making. He was advised at the midnight hour to back off a little bit, to pull back, and he chose not to. And he went into this knowing, on the one hand, the polling information about the economy in 2009 was horrific, and he chose to move in. So on the environment over here on health care is very positive. Americans love their care and so forth. So the issue is salience. Is there salience here as opposed to the economy? This thing is dripping with salience, and he went because he felt it had to be done for the moral reasons. So I think that, but this is the hand we're dealt. I mean, we have to, if this thing is repealed now, this healthcare will be radioactive for the next 25 years.
Yeah, I know repeal is difficult, but I do remember catastrophic.
You got it.
The 1980s. I actually just have a question that I've had for quite a while, and given your background in communications and your polling information and whatnot, is that the Republicans have been very effective in their communications. The Democrats have not. And what insights do you have in terms of why the Democrats have not? Has it been a political decision to not respond to the
I think
ACA? Is it just ineptness?
Let me give you a chilling story. In 2009, the Republicans didn't use the individual mandate. If they had brought that into the national discussion, they could have just blown this thing apart. So all these brilliant strategists within the Republican Party missed a time bomb that was inside ACA. So they're not that smart. I think what happened was the Democrats failed to understand the environment in which the public opinion environment in which they were working. And I think they assumed, like all good Democrats do, that people will, pay attention to the substantive details of this. They should have been informed from day one that this thing is going to be so hard for all these reasons. People were happy in the beginning of 2009, and without patting myself on the back, the first paragraph of the first memo I wrote was, "People will not understand this stuff. Therefore, that has to inform your public strategy." I think that's the big mistake. In conclusion, what is missing right now is people who would be sympathetic to ACA or the administration or whatever do not have 4 or 5 understandable benefits that they can use over the coffee table in a bar just to say, hey, what about pre-existing? What about bankruptcy? What about kids? What about... That's been the failure of it. We did not... If you make this stuff too highfalutin and too substantive, people are just not going to understand it. They just won't... We have to... And so, again, I think that's what happened. I think but the Republicans practice brute force politics, which is they just go at it. And there was an article by Krugman this week in the New York Times in which he describes, he raises the question, these guys they know they can't be, they're not telling the truth. He just says that their policy solutions are non-existent. So if Romney or whoever is elected or Gingrich is elected, they will face a brand new reality because he was saying their campaign is so substantively untruthful. Whether he's right or wrong or not, I believe the Republicans practice brute force politics, which is just all-out attack. They were silent for they didn't know what to do. First 3 or 4 or 5, 6, 7 months, they were looking at, and then finally one of them said, hey, wait a minute, the Republicans are not with Obama on this stuff, and that's when it turned. It turned in about September of 2009. So it's not as if they were brilliant during 2009. They were not. They were knocked on their fanny. They thought people wanted reform. And they missed this whopping individual mandate thing, which is now part of their arguments. Mandate is an evil presence and so forth. I worry that privacy is the equivalent of the missing mandate. Privacy in the hands of the Tea Party saying the government's going to get your records and you are going to have everything exposed and things like that could be a dangerous, dangerous weapon. Now, fortunately, substantively, the healthcare community is totally behind electronic medical records. And Republicans would have a hard time saying, I'm not for electronic medical records, or the advance of electronic medical records and so forth. But, these things, these realities, they had to inform strategy. And this right here, honestly, in 2009, 2010, 2011, you cannot find a group of Americans who would not embrace these fundamental convergence, values, benefits. That's the deal. So that's where we need to go. And I would practice brute force politics. To the Republicans, I would say, you're against all this. You cannot have it both ways. And we just have to begin to say, they're against pre-existing, they're against, all that stuff, and then see what happens. Better than silence.
Okay. John, thank you.
My pleasure.
This has been both informative and clearly from the comments and questions, it has touched people's, concerns, and what can we do. And so I want to thank you.
My pleasure.
Thank you very much. I want to thank Robin Strongfield. I want to thank Pat Forde Regner. I want to thank Audrey Shepherd from Amplify, from the Martilla Strategies. And I hope that we can now, sort of figure out how to coalesce the nursing, profession, because given that the nursing profession may be really, really important to the future of the Affordable Care Act, we need to take that on. Sarah?
What will be the next steps from your perspective, since you wonderfully organized this?
Well,
Now our little soldiers are ready to go.
Yeah, I'm actually, yeah. What I'm going to do, because we're going to continue to work with Amplify, but I'm going to give the mic to Pat, to kind of address some of that.
Well, I think we're, as a team, very willing to work with groups for the future and how you move this along. I would take from this, too, that I wouldn't assume that all of one's contacts, membership, individuals you're engaging with have remembered the major findings of this. And that, first of all, to even think about how you get that message out, to just reinforce, why did we want healthcare reform in the first place? And not that everybody is still there with you. When you look behind you, are your troops there? And it would be interesting, I think, for many of you to, get some feedback from your constituencies as to where they are on all of this. And then, we're happy to have further dialogue. And I think you also may be looking at opportunities that are coming up where you might want a similar presentation. And then if there are specific things that you're interested that you would like to explore, I think we're very happy to do that. So I'll just leave it at that. And then, Jean is a major contact for many of you, so let us know, or you can contact us directly. So, and again, thank you all for coming. And, I think these are very critical messages and important to the future of nursing and of public health.
So thank you, everybody. Have a great day.